Hello, I'm Rob Terry, and welcome to this video on the Karuna Healing approach to assessment in sex and porn addiction treatment. Since I'm primarily viewing sex addiction as a symptom of other mental health conditions, assessment is extremely important. Leo Tolstoy said, "Happy families are all alike. Every unhappy family is unhappy in its own way." I believe this applies because even though there are commonalities that we see that we can treat across the board in porn and sex addiction treatment, for the most part, every person is unique, every client is unique, and the treatment plan needs to be customized to the unique situation. I came up with our assessment program. I tried to combine the very best of how CSTs treat OCSB, out of control sexual behavior, and how they assess for that, and how CSATs assess in sex addiction recovery. I'm also combining the work of other good researchers and mental health practitioners, John Gottman, David Burns of the Feeling Good Institute, and trying to use the best practices for assessment. Also, in combing through all the research studies about compulsive sexual behavior, I started noticing a lot of good assessments that different researchers are using, and I've tried to put together the very best assessments that give us the most information while minimizing the time spent that you're spending. So it's about a 2-hour process that you'll spend filling out these assessments, and then in addition to our in-person sessions. I assess for sexual behaviors, obviously. Like I said in the sexual addiction frameworks video, I'm not so much assessing whether or not you're a sex addict, but I'm assessing a lot about the sexual behavior. The frequency, if it's a regular or daily, or if it's more like a binge, the different sexual behaviors that you use, and if it's porn, the types of porn, and so on. We assess for co-occurring mental health disorders. According to research, clients seeking treatment for sex addiction, about 60% have co-occurring depression, about 40 to 45% substance abuse, alcohol or drugs, about 45% anxiety. ADHD is about 27%. This is kind of a subspecialty for me, is ADHD and porn and sex addiction recovery. I'm ADHD. I diagnose and assess for this, and I believe of over 100 assessments that I've reviewed, my number is about 35% are diagnosable ADHD, and about even up to 50 to 60% have high to medium degree of ADHD-like symptoms. And you might find it interesting. I'm starting to do some research, and the question that I find most highly correlated to compulsive sexual behavior is, how often do you feel restless or fidgety? OCD is another that we assess for that's important. Personality disorders, NPD, narcissism, BPD, borderline, DID, dissociation. And we have our treatment plan is to cover everything that we assess for. We assess for emotion regulation. That is probably the most important that's present in porn and sex addiction, and that correlates to ADHD as well. With emotion regulation, we have experiential avoidance, and that is when we have a very difficult time being bored or feeling anxiety or feeling the depression, and we turn, even subconsciously sometimes, to porn to escape or to soothe us from this negative emotion. Assess for trauma. The adverse childhood experience assessment, a short questionnaire. People that took that score 5 or more are 10 times more likely to experiment with illegal drugs. So trauma is obviously a big thing. We assess for attachment security, and I've done a lot of my own personal work on this, and we have our own custom attachment security. Even if you don't want to work with us, please find the attachment security test on our website and fill that out and look at, and you can get your results and some information on healing your attachment security. Patrick Carnes found that over 92% of his clients seeking treatment for sex addiction had insecure attachment, and that number has been validated to the 85-90% level with other studies. If you're in a relationship, we assess the status of that and your history of relationships. We're partner in trauma, betrayal trauma sensitive, so we don't blame the partners, but this is good to understand. We assess for self-compassion, shame, assess for moral conflict, inner conflict, erotic conflict, sexual orientation conflict, and sometimes treatment of those are a little more challenging, and it's important to understand that. Assess for motivation and ambivalence, assess for impulsivity, narcissism. If you're watching this video, you're probably not narcissistic. You're probably not a narcissist of official NPD, but I view narcissism as a spectrum, and you'll probably have some degree of narcissism, entitlement, grandiosity, delusional behavior. Often we delude ourselves to protect from shame and guilt. Assess for suicidality and hopelessness. Assess consequences. How severe are the consequences of your sexual behavior? Relationship consequences, self-confidence, shame, emotional and spiritual consequences, financial consequences, physical. This is important to assess for, and then also for you to kind of have some self-reflection and introspection in those areas. So in my past life, I was a data geek, and I put together these assessment tests and have an automated report for you that it'll take you about 2 hours to do the online test. This is a good time for introspection. Then I can look at the data and compare your results statistically, both to the general population and to others seeking treatment for sex addiction, to understand where you score. And this focuses the work, and it saves at least a couple sessions of time, in my opinion. So this is, I believe, the most efficient process. And then I'll add my own insights into the automated results from our sessions, and then as a result, you'll get a 50-page document with your assessment results, and then we'll go through the program, and then we'll assess your progress in these areas. And most of all, this is going to help you going forward to get a unbiased advice from a specialist on what you need to do, what you need to focus, how important it is for you to stay in therapy, and so on. Because unfortunately, a lot of times you go to a therapist and they kind of have a default that they want to keep you forever, for years or longer. And so this is an unbiased opinion. You're going to be in my program for 2 months, and then we'll give you this assessment for you to understand how to proceed in the future. And thank you for watching to the end, and hope to work with you. Thanks.